So thanks for having me this morning. My name is Jessica Rohde. I am an academic general pediatrics fellow at Nemours AI DuPont Hospital for Children in Wilmington, Delaware. And one of my fellowship projects has been working on looking at what primary care providers' views on caring for opioid-exposed infants are. So as some background, as everyone is aware, there is a opioid crisis in the United States. And as a result, there are more babies who are being born exposed to opioids in utero prior to their delivery. Some babies who have this exposure develop something called neonatal abstinence syndrome, which is a syndrome that relates to withdrawal of the opioids from their main points of action in the nervous system and the GI tract. The incidence of NAS, or neonatal abstinence syndrome, has increased accordingly between 2004 and 2014 from 1.5 to 8 infants per 1,000 born. And there has been a lot of attention paid necessarily to the care of this population in that neonatal period as they're going through these withdrawal symptoms. But there's really limited literature and attention that's been paid so far to the primary care of these infants after their neonatal period. And primary care providers who are on the front lines doing this work, we thought would be key informants to start getting some information about the status of caring for this population. So the objective of our study was to identify challenges and resources for this population from the perspective of primary care providers. And our approach was to use a modified Delphi study design with 2 rounds. And we surveyed primary care providers in the pediatric Nemours health system, with the first round of questions including 6 open-ended questions related to the needs and challenges of these infants, their families, and the primary care providers in caring for this population. Also, we asked them to identify what resources are currently utilized and what resources they feel are lacking, and then any other thoughts or comments that they had. Our research team coded these open-ended responses and developed themes, which you can see here in a word cloud, to sort of identify the common answers from the first round. And then in the second round, we circulated these themes that we coded from the first round of responses and had providers identify what themes were most important to them. So we ultimately had about a 42% response rate from our first round and about a 33% response rate from our second round of surveys. The majority of our respondents were physicians rather than nurse practitioners or physician assistants, female and white, and they most often worked in suburban practice settings. There was quite a range for how many new infants in the last 12 months they cared for who had a diagnosis of neonatal abstinence syndrome or had opioid exposure in utero, but the median was around 5 for both surveys. For the challenges for infants and families, after the providers prioritized these in order of importance to them, there were some common themes across both of those questions related to lack of parenting knowledge or skills, as well as to issues related to lack of support for the infants and their families. And then just to highlight some of the challenges the providers identified for themselves, these included most often time constraints during visits, follow-up adherence issues with the medical care plan, and then communication issues, both with families as well as other medical providers or other members of the care team for this population. Related to top resources that providers identified currently using, the most common, almost 70% of providers responded, this was a top resource, was the WIC program. So for people who may not be familiar with this, describes the Special Supplemental Nutrition Program for Women, Infants, and Children, which is a state-run program with federal grants supporting it that targets low-income, nutritionally at-risk populations, and specifically pregnant, postpartum women, and infants and children to age 5. In the first year of life, this program provides formula for infants or breastfeeding support if the mother is breastfeeding, as well as other supplemental foods as the child gets older, and to the parents as well. Currently, WIC serves about 53% of all infants born in the US, but this looks like our providers are using this more often than average and currently being used. The second most common resource being used is the early intervention resource, which again, for those of you who may not be familiar with this, this is a program that provides developmental evaluations and services to children age 0 to 3 years who may be at risk for developmental delay or have developmental delays identified. And the third most common resource being utilized, excuse me, is Child Protective Services. Top resource identified as being lacking, but potentially desirable by these providers. Again, similar to some of those needs and challenges questions, the most common top response was some kind of support for parents. Parenting education was second to that, tied with mental health care. And then community resources and home visits were the next two most common responses. So this was a brief presentation, but overall our summary of these surveys have shown that there are challenges in the primary care setting, and some of the challenges as perceived by the primary care providers are related for infants and families, which seems to make sense, and these often are related to parenting and support. Some of the top issues for providers themselves are related to time, follow-up, and communication. And then for resources, as we just reviewed, the top utilized ones are currently WIC, early intervention, and child protective services. Those that are lacking, again, related to support and education for parents, mental health care, resources in the community, and home visits. Some of the next steps that we're contemplating taking are to identify approaches that providers can take to help address some of these challenges and to maybe address some of the resources that are desired, as well as to connect them to resources that maybe are available in their communities for them. And also to consider input from other stakeholders. One of the limitations of this study is that we really are just looking at the perspective of the primary care providers, but the families and other team members who are involved in the care of this population have valuable things to say and valuable insights to provide about the barriers to the care from their perspective, as well as approaches to enhance outpatient care. That was a brief overview. I'm happy to take any questions or comments or feedback now, or if you have other questions or comments later on, I'm happy to have people email me as well. But thank you for your attention.